Hi, I'm Tony Willis. I'm the Clinical Director for Diabetes for North West London, and I'm just wanting to explain a little bit about the new EMIS web template for diabetes and some of the features on it, and so I suppose some of the background of why we're trying to do this. So to put it in a nutshell, diabetes is a relatively complex condition, but what we're trying to do is put all of the tools at clinicians' fingertips in order to help them manage people with diabetes more effectively, more efficiently within the time constraints of a consultation, in order to improve patient outcomes and patient experience. We understand where patients achieve some of the key targets, some of the blood pressure, cholesterol and HbA1c, and have elements monitored regularly that outcomes improve. So here we are. This is the diabetes template, and what we've put together is a summary page which has really all of the key information on it and key elements that you might want to capture for somebody with diabetes, and then a number of more detailed pages that go into greater depth, provide links to clinical guidelines and some of the key parameters within which you might be keen to try and work. So we've got a drop down here on the first page, and you can see some of the key diabetes diagnoses. Obviously type 1 and type 2 are the most common. Latent autoimmune diabetes is a less common condition. It's basically type 1 in older patients, so coming on in sort of young to middle age people generally, and then a number of less common elements. You can see over on the right here, you can click on an individual element and see any previous history. We've put in a really short history and examination section here that's a free text component, that if you've got any things to say, so a patient has been recording blood glucose values regularly or something like that, just some notes that you might want to make as part of the consultation. You can enter a blood pressure. You can see previous blood pressures. One of the really fantastic features on this is being able to right click on this little graph and see it larger. I find this really useful in my consultations with patients, being able to show them some of the changes over time. I think where this particularly is relevant is looking at previous HbA1cs, and sometimes being able to correlate that with a patient's body mass index, so that it can be a really motivational factor. If a patient has lost weight, they see an improvement in their HbA1c value or their blood pressure, maybe they're able to come off medication as a result of that through lifestyle change, and that, you know, it's all about trying to keep patients motivated and supporting them in some of that behavior change that is really crucial. Again, cholesterol here, you can see a graph of that. You can capture patient smoking status very rapidly, height and weight, and auto calculation of the body mass index. We've put the foot risk here, so key elements here are whether a patient is low, moderate or high risk, whether they've got an active foot ulceration, or whether they've got a previous amputation of left or right leg. There are a couple of elements that were taken out of QOF recently, so I think probably about 3 or 4 years ago: body mass index and urine protein, both of which are really key parts of care processes for diabetes. And what we're trying to do is encourage that to be recorded, because we know that 50% of patients approaching end-stage renal failure have diabetes. Again, being able to capture some of the diabetes retinal screening data. Another key component is around frequency of hypoglycemic episodes for patients on sulfonylureas and or insulin. A lot of patients have hypos, and they don't necessarily mention this without being prompted by their clinician, so just trying to make that easy to capture and to think about when you're seeing somebody with diabetes. Mental health, again, a lot of patients with diabetes have mental health concerns or mental health comorbidity, trying to make that easy to capture. And then just a little section here on goals and priorities and a care plan. Again, some record of this when you see the patient next time is really useful. Moving on to structured education, there are two key codes that we're using here, one of which is referral into the program, or the patient has declined referral. Again, trying to increase the number of patients that get access to this in order to support self-management, which you know is crucial in diabetes. And then allowing recording of the structured education outcome. So that's really the summary page. I'm just going to dive into a couple of elements. Let's look at the diagnosis page. Here we've got some components, some links into the clinical guidelines, and this just gives you some thoughts on who to test, some criteria for diagnosis, and when not to use HbA1c, which is the routine one that we should be using, little flowchart on how to test and when to repeat, and what constitutes a diagnosis of non-diabetic hypoglycemia, in other words pre-diabetes, and how to code that. So similar guidance exists for some of the other major elements that are on the template. Just looking at blood pressure, here's the blood pressure guidelines again, so lifestyle intervention, the importance of that, the ideal blood pressure targets, which note if somebody has cardiovascular disease, ideally their blood pressure should be more tightly managed in order to reduce their risk of further events. I'll just go through some of these other bits around HbA1c, so glycemic control. Note here the individualization of HbA1c and the idea that patients who are older and more frail should have less intensive glycemic control. Here's a ready reckoner around age and a number of factors that may influence what your ultimate target HbA1c might be. So as a more frail patient, we're looking at a much more relaxed HbA1c target, whereas younger, more active patients on simpler regimes with less comorbidity, ideally you're aiming sort of 48 to 53 or less, as long as hypoglycemia isn't getting in the way. So those are really some of the key components, and you can go through each of those and see what they are. Lifestyle, feet, kidneys, and again there's access to guidance on the page, and at the end here a whole load of Northwest London guidelines and what quick links to each of those are. Some links to patient information, so things around diabetes videos. We find that texting these to patients can be quite a helpful aid after you've seen them, and then a chance to feedback about the template. So there we go, that's the new EMIS Web Diabetes template.